In 2010, about 47 million Americans were uninsured. Healthcare costs were rising at double the rate of inflation. Premiums were high and threatened to increase by year. America was spending more on healthcare than any other country in the world. The number one cause for America's bankruptcy was due to soaring medical bills. The government had to do something about these problems. On March 23, 2010, President Obama signed the Patient Protection and Affordable Care Act, also known as Obamacare, into law in order to reform the healthcare system by extending affordable, quality health insurance to all Americans and lower the amount spent by America on healthcare. In the past 5 years, Obamacare has insured about 20 million people. However, many Americans feel that Obamacare brings more problems than benefits to the healthcare system, which include the rapidly rising premiums, deductibles, and penalty fees. Dear future President and Congress, the most urgent issue that you need to address in 2017 and the years to come is the future of America's healthcare system. The Affordable Care Act should not be repealed because it has offered better quality and more affordable health coverage for a wider range of Americans ever since it was put into effect.
And people were ending up bankrupt because of the cost of health care. And now with the Affordable Care Act, that is happening much less.
What I saw was that before Obamacare, certain families would simply ignore those visits because they couldn't afford to pay for them.
Most people, about 85% of people, have insurance through their job or maybe through another government program. But the last 15% of people, or 10% depending on where you live, had no health coverage.
The purpose of Obamacare was to give universal coverage to everyone in one way or another, so that if someone were to be inflicted by a sudden disease or got into an accident, they would have insurance companies to back them up no matter what.
Because these parents are now inclined to, bring their children to the office in a timely manner for their regular screening as well as for their sick visits.
They intended to do this by inviting various private health insurance companies, such as Blue Cross Blue Shield and Aetna, to online healthcare exchanges from which people can choose the plan that they want to be covered by or get cost assistance from federal subsidies.
A deductible is the amount you owe for healthcare services your plan covers before your plan even begins to pay. A premium is the amount you pay for your health insurance or plan. It can be paid monthly or annually.
Most premium growth has been relatively modest, and nearly 8 in 10 returning consumers can get covered for $100 a month or less.
Through this system, every person has to have insurance. You either have to buy it, get it from your employer or the government, or pay a fine. This helps us to get closer to universal coverage, which drives down costs because more people stay healthier with regular checkups instead of going to the ER and ending up paying much more.
If you don't have insurance and you get sick, you go to the hospital. And that costs 10 times more than it would cost if you were seeing a primary care physician and going through the healthcare system and getting the coverage you need. Sicker people also cost a lot more. And when they get sicker because they didn't have a doctor to go see because they didn't have coverage, the rest of us all end up paying these uncompensated care costs.
Before, if you had pre-existing conditions, you were not guaranteed coverage, and if you were a woman, you were charged more than men. Under Obamacare, insurance companies cannot deny coverage to these people.
Young adults up to the age of 26 can stay under their parents' plan. This has insured about 4 million people.
Individuals that have pre-existing conditions, heart disease, diabetes, cancer, can no longer be denied insurance because of that pre-existing condition. The fact that women can no longer be charged more because of their gender.
Whenever they feel that their child is sick or their child needs any kind of medical care, they walk into the office and they can get the care that they need.
Small businesses also benefited. If small businesses have less than 25 full-time equivalent employees who make less than $25,000 in average annual wages, then they are qualified for subsidized health insurance. Under the employer mandate, large employers with over 50 full-time employees had to provide health coverage to their workers. This helps to provide coverage to people who aren't covered by subsidized private insurance or Medicaid.
It really depends on where you are in the spectrum, in the income spectrum, right? So people with the lowest incomes who are above the level for Medicaid, they get very, very deep subsidies.
Around 16% of the population went without health insurance in 2013. At the end of 2014, less than 13% of the population was uninsured. By 2015, the uninsured Americans were less than 10%. Since Obamacare was signed into law, about 20 million Americans have gained health insurance. Obamacare is not perfect.
But there are certain people who are caught because their incomes are maybe just above the level for a subsidy, or they're getting a small subsidy, and it really is impacting their ability to afford insurance.
Premium rates have increased, with the national average being almost 25%. Deductible rates have been steadily rising. In 2017, deductibles will go up to $7,000 on even the cheapest of Obamacare plans.
The president himself has said, this is not perfect. You know, if there are other solutions, other suggestions for how to improve this thing, let's do it.
However, these problems do not outweigh the benefits granted by the Affordable Care Act. Repealing Obamacare is not the solution to these problems. In fact, repealing it would have adverse effects.
People are not going to be getting the coverage they need. They're not going to be seeing doctors. And from a financial standpoint, if we were to repeal the ACA, the state of Maryland would lose about $30 billion over the next decade that was coming from the federal government to help us cover our folks. These are not good options.
Less Americans would be able to afford coverage, including women, people with pre-existing conditions, and young adults up to the age of 26.
We can do that through having comprehensive reform on how prescription drugs are administered and how they're paid for. We can do things like working on risk adjustment. We can look at expanding the pools even further. All these kinds of discussions are more constructive than just repeal.
Future President, to improve the healthcare system in America, you should first not repeal Obamacare. Next, make the Affordable Care Act more affordable by bringing down the cost of premiums, deductibles, and out-of-pocket costs. You should also increase the range of people subsidized by the government. It will not be a quick fix, but these are the first few steps you can take to make America healthy again.